Hi there again. I'm Dr. Gary Schoenrock, and I'm back to give you another video on some of my clinical dental hints and tips. My last video was all about buffering local anesthetics, and I have to thank everyone out there for their nice comments about it. Those people who are doing it are having terrific results, and those of you who are not, I strongly urge you to watch the video and see what you can do with it, because it's a really nice thing to do. Now, today's subject is going to be local anesthetics, specifically the effects of epinephrine. Now, you know that some of your patients say, oh, I'm allergic to epinephrine because when I get injected with it, oh, my heart's racing. I feel like I've run around the block a couple times. Well, that's not an allergy. That's just what epinephrine does, and some people are sensitive to it. Let's take a look at this chart and I'll show you some things. Now up here, we have our old buddy epinephrine. Everybody's used it. Lidocaine, 1 to 100,000 concentration of epinephrine. And here's what it does. Epinephrine acts on 3 different receptors in the body: alpha-1, beta-1, and beta-2. And what do these do? What does that mean? Well, alpha-1 is responsible for vasoconstriction. That's why we use it. You constrict the small blood vessels and the anesthetic hangs around longer. Common sense. But it also works on beta-1 receptors. What does that do? That affects your heart rate, and it can affect your heart rate in sensitive individuals quite a bit. This is where they get that epinephrine rush that we're talking about. Now, the beta-2 receptors cause bronchodilation and also a little dilation of the large blood vessels. Now, the bronchodilation is exactly why we give epinephrine through an EpiPen to people that are having an allergic laryngospasm. What does that do? That opens up the airway. All right? Now, epinephrine works on these fibers in a particular way. Epinephrine works 50-50. Kind of doesn't discriminate. Just alpha and beta kind of, the same. So alpha and beta here. So what happens? The blood pressure down here is pretty negligible. It doesn't change very much. Why? Because you're constricting the small blood vessels, but you're also dilating the large blood vessels. So the net effect on the blood pressure is pretty much 0. Now, what does that mean to us? Well, here's a little interesting thing that most people don't know about. There's another vasoconstrictor called neocobrifrin, right? Now, don't get confused. It comes in 1 to 20,000 concentration, whereas epinephrine comes in 1 to 100,000. Those concentrations are pretty bioidentical. In other words, they work just about the same, right? So don't get confused about that. Now, what does neocobrifrin do? Well, it also works on alpha-1 receptors, and it has the same vasoconstricting effect. That's a good thing. That's a good thing. But what happens here with the beta-1 fibers, it only has a small effect on the heart rate. We'll see why in a minute. And then beta-2, a small effect on the large vessels and bronchioles, okay? So you have a concentration of neocobrifrin that works on these receptors 75 to 25. 75 alpha, which is, wow, you get a lot of good vasoconstriction, just like epinephrine, but only 25% beta, all right? So that's a small effect on the large blood vessels, all right? So what happens to the blood pressure? It goes up slightly. So your patient won't have the epinephrine rush because they don't perceive a small effect on their blood pressure like they would with their cardiac activity, all right? Now, this is a good thing to use. I've read some studies that show that, oh, well, neocobrifrin's not all that good for that, and And I've also read some studies that say it's terrific. I'll tell you how it works in my hands. I think it's very, very good to use when patients report that they have an epinephrine rush. I also use it when I'm using intraosseous injections. You know what those are. Stabident, X-tip. You perforate a little hole in the gingiva down into the intraosseous bone, and you inject the local anesthetic directly into the cancellous bone. Woo! Try that with epinephrine, you're really going to get a rush. Neocobrifin, not so much. Not in my hands. So here's just a couple little tips on epinephrine that I think will help you out. Try the neocobrifin. I've got it in my operatory. I think everybody should have it. So give it a roll and see how it works for you. Thanks a lot for your attention. We'll see you again with some more hints and tips.